All right, welcome to another episode of Botox and Burpees. I'm your host, Sam Rhee, and I have with me my very special guest, Dr. Lawrence Tong from Toronto, Canada. You may have seen him on our other podcast, Three Plastic Surgeons and a Fourth, which unfortunately is going to be on hiatus for a while. And so while that podcast is sort of in limbo, I thought I would bring on LT, as he is affectionately known, to talk about a couple topics. Um, I've known LT since we were residents. We trained together. He was my chief at University of Michigan. He is probably he is one of the most talented plastic surgeons I know. And he is also a Canadian, which means he right now is probably a lot less controversial than say maybe some of us Americans here right now. But anyway, all right, to the topic. Our topic today is 5 best facial SPF sunscreens. And why would you want to listen to a couple plastic surgeons talk about sunscreens? Well, I'll tell you why. Because when I was looking up sunscreens for myself, I noticed that there were a bunch that were, quote, dermatologist recommended, which is great. However, when I looked at them, 3 of them are ones that I really don't think are that awesome if you have certain considerations that are important to you in regards to your health. So I wanted to recruit another plastic surgeon to talk about this because I think in some ways we do see similarly a lot of patients that have tons of problems in terms of facial aging. We manage facial aging. We do obviously facelifts, neck lifts, brow lifts, eye lifts. And in doing so, we also give a lot of recommendations in terms of how patients can minimize aging, how they can slow, prevent, treat some of these issues. And in some ways, I think we might be a little more practical than some of the dermatologists out there when it comes to finding something that works in terms of a sunscreen that is best for you. This show is not a substitute for professional medical advice, diagnosis, or treatment. It's for informational purposes only. Treatments and results may vary based on the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified healthcare provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking medical advice for something in this show. So, why do we need sunscreen? It's one of those things that is obvious, but maybe the details about it are not so obvious. So, Larry, let's talk a little bit about SPF sun protection and what sun exposure does to our skin.
All right. So sun exposure is ultraviolet radiation, and that can have effects on the skin that are undesired. And basically, when we're talking about ultraviolet rays that affect the skin, we're usually talking about UVA and UVB. That's ultraviolet A and ultraviolet B. And they're different because they contribute to different types of changes to the skin. So UVA is a longer wavelength ultraviolet ray, and it penetrates deeply into the dermis. And this is the one that causes photoaging. That is wrinkling, loss of elasticity, and age spots. It also contributes to formation of skin cancer and creates oxidative stress, which is creation of free radicals. So what that means is that if you are exposed to UVA for a cumulative period of time, you will start looking older. And I think it's very important to stress to everybody that once you get beyond a certain amount of sun damage, you cannot reverse that. No surgery, no lasers, no creams, no peels can fix that. So it's very important to preserve what you have and protect yourself against the sun. So anyways, UVA is also a type of radiation that can penetrate clouds and glass, like in a car. So for people who think that if it's a cloudy day, they don't need to wear sunscreen, that's false. It will still affect you. So even on days where it does not look sunny, it is important to wear sunscreen. The other type of radiation is UVB. This is a shorter wavelength, and this primarily affects the epidermis, which is the skin surface. This is the type of radiation that causes burning of the skin. That gives you the sunburns. And this does not penetrate as much, but this this type of radiation is more important for causing skin cancers. So both of these types of ultraviolet radiation are harmful to you. And, as plastic surgeons, we do not recommend tanning of any type because in the long run, you're going to pay for it. You're not going to be happy with it. In the short term, when you're young, you think nothing's going to happen and it makes you look better. But in the long run, it's not a good thing. So it's very, very important to stress protection from the sun for the short term and for the long term.
Absolutely. And I think a lot of the tanning salons use primarily UVA, so you don't necessarily feel a burn like you do because there's very little UVB. But in terms of aging, as you said, in terms of skin cancer risk, it's terrible for your skin, as you mentioned. And so I think for everyone, sunscreen use has to be sort of part of your daily regimen. Don't feel like this is something you need to not wear on certain days, like you mentioned, because it's cloudy or because you don't see a lot of sunlight. Like you will experience more sun damage than you think, even on a day where you don't see any bright sun. So for sure, that that wearing of daily sunscreen should be a must for everybody. And so that's why finding the sunscreen that works for you. The best sunscreen, honestly, is the one that you're going to wear every day. It might be the best rated, it might be awesome, and everyone loves it. But if you don't like that sunscreen and you don't wear it, then it's useless. So let's help you find a sunscreen that works for you. There are really two types of skin protectants here: mineral sunscreens and chemical sunscreens. So let's talk a little bit about mineral sunscreens. What are the mineral sunscreens, Larry, that are offered?
So in general, mineral sunscreens are sunscreens that reflect or disperse the light that comes to your skin. And, these are mainly ingredients like zinc oxide and titanium dioxide. The advantages of mineral sunscreen is that they work immediately once you put them on, and they're good for sensitive skin. There's less irritation and allergic reaction, and it's FDA recognized as safe, and it gives good UVA and UVB protection. For environmental concerns, it's typically safe for marine ecosystems because some of the chemicals in the chemical sunscreens have actually been shown to be harmful to marine ecosystems. There are some concerns about mineral sunscreens, and Sam, if you want to discuss those a bit.
Yeah, the one
Downsides.
thing is that people hate is the white pasty look. Like, and I know that a lot of parents will slap mineral sunscreens, like you said, titanium dioxide or zinc oxide on their kids because they don't care what their kids look like. They just look like these white balls of powdery white paste on them. But they won't use that for themselves because it looks crappy. It's thick. It can be greasy. It's hard to put on because of the texture. And if you sweat or if you just kind of physically wipe it off, you lose that protection. So I feel like I have used mineral sunscreens quite a bit in the past, and I just feel like it's that those cons, and especially in terms of the white pasty texture, turns off a lot of people. Like I know my daughter, my wife, they will never use a mineral sunscreen just because it just makes them look like a ghost.
Yeah, and you're exactly right. It's mainly relegated to children. But we'll talk about it later, but there are hybrids and different formulations of the mineral sunscreens that make them a little bit more palatable.
Yeah. So let's talk about chemical sunscreen. So there are 5 major chemicals that are used to block ultraviolet radiation, and they all have terrible names that I can't ever remember. Avobenzone, oxybenzone, oxinoate, no, so octin oxate, homosalate, salate. And so all of these are chemicals that block ultraviolet radiation. And the biggest problem, which you mentioned, well, there are a couple big problems. So one of them is that they have endocrine disrupting activity, which can result in hormonal changes and even birth defects in some observational studies. So these are the type of chemicals which also are, as you mentioned, not friendly for ecosystems. They are toxic to corals. And two of these are banned in Hawaii, US, Virgin Islands, and Mexico because of that. And those include oxybenzone and octinoxate. So most sunscreens don't include those two, but the other three, homosalate, avobenzone, and octisalate, are still present in a lot of sunscreens. And they are still considered at moderate or at some risk in terms of endocrine hormonal disruptive effects. So, how do you feel about chemical sunscreens, and what do you recommend to your patients in terms of them?
Well, basically, um, you should try to tailor the sunscreen to whatever the patient's needs are. So, one of the things that is a pro with the chemical sunscreens is that um, it just looks better when you put it on. So if somebody is conscious about their appearance, then you're probably going to head towards a chemical sunscreen. But if you have sensitive or reactive skin, then you're probably better suited for mineral-based sunscreens. Um, and, you know, like you said at the beginning, the one that you're going to use is the one that's going to give you the best protection. And if you have, concerns about environmental concerns, a mineral-based formulation reduces the ecological impact. But you want to have a sunscreen that has what's called broad spectrum protection. That when you hear about SPF rating that people talk about is that it only applies to UVB. So when you're using a sunscreen, you need to use one that's designated as broad spectrum, and that will cover both UVA and UVB. And with the chemical sunscreens, you have to apply it about 20 minutes, half an hour before you actually go into the sun, because they don't work immediately. So there's a number of factors that are used in deciding which sunscreen to use. And Sam, I know you have a list of sunscreens that have been dermatologically recommended, and I wonder if you could go over some of those and how you feel about them.
Yeah, so let's talk about them. You're absolutely right. The best sunscreen is the one that you use regularly. And I have used chemical sunscreens my whole life. I like them because I don't like the pasty look. I've tried the pure mineral sunscreens and they just don't look awesome. And oftentimes I will just weigh the benefit risk about chemical sunscreens and, like you said, the benefit of having them not look terrible on me and the ease of use. I just like spraying them on or, applying a stick to my face, and it's good. I'm good to go. But as you mentioned, there are a couple. Let's talk about the ones. But I think we're going to have a couple alternatives that I think now have come out, which might actually provide the benefit of a chemical sunscreen without all of these concerns that people have raised about endocrine disruption, reef safety, all of that. There are two that are purely mineral based that dermatologists have recommended in general. And if you like these two, you should stick with them. I think they work great. I've used one of them, and I think they're better than most of the mineral sunscreens out there. The two that I've seen are La Roche-Posay Helios Mineral Tinted Sunscreen SPF 50. This is a pure mineral sunscreen, zinc oxide, titanium dioxide. It's slightly tinted to help minimize that white cast, and it's ideal for sensitive skin. And I have tried this one. I like it. The tint, it doesn't really work perfectly for me. But out of all the mineral sunscreens out there, I think this one is reasonable.
So I'm
Your
curious
thought?
well, I've never used that before, but what does the tint look like? Is it supposed to be less white?
Yes, it's like slightly brownish, I guess.
I see.
But I kind of have brownish skin, and it doesn't really match, so it looks off on me. Like I look sick. or something. I don't know. I don't look healthy. It looks a little odd. The other one is Vanicream Mineral Sunscreen SPF 30. And this one is supposedly, I haven't tried it, but supposedly ideal for eczema or reactive skin. It's dye-free, fragrance-free, paraben-free, and it's also pure zinc oxide. And so, I think that probably works better for some sensitive skins. Uh, the other thing it does contain is ceramides for barrier repair. And I have used lotions with and without ceramides, and I would say for some people, ceramides cause them to break out, and for other people, they're totally fine with it. Uh, I think it really depends. Like I think CeraVe or CeraVe, I don't know how you pronounce it, has ceramides, and I've used that a lot in my practice, like post treatment. And some people just break out with ceramides. So
Hmm.
I think you should try it, see if you like it. The zinc oxide formulation might be a little bit more easy for your skin if you're someone who tends to break out.
Yeah, the Vanicream is a brand that we actually used on our kids, and it seemed pretty good. It did make them look a little bit white, but they're kids. Who cares? Good sun protection is important.
That's right. Now, the three that the dermatologists have recommended in general, now these three are both mineral plus chemical sunscreen combinations. And the first one I have also tried is Elta MD UV Clear Face Sunscreen. And this is both a mineral plus chemical. It has micronized zinc and niacinamide plus octinoxate in a 7.5% formulation. And it's very nice in the sense that the zinc is micronized, so it's less likely to have this like pasty texture to it. If you like niacinamide, it is for a lot of people anti-inflammatory. If you are prone to acne or rosacea, it can be helpful in terms of calming the skin. But and they say no white cast, but I mean, like that's all relative. I think I have a pretty dark complexion, and so it does lighten my skin when I put that on there.
Yeah, I've used the Elta MD. It does. I mean, I think all the sunscreens to some extent give you, even the chemical ones, give you some sort of whitish cast. So you just have to take some time to sort of rub it in. But the Elta MD is a good product.
Yeah. Now the other two I have not tried. The first one is Supergoop, and they have two types: a every single face watery lotion brand, and then an unseen sunscreen brand. And both of these are pure chemical sunscreens, no mineral to it. And that's why people love it, because it's a clear gel. People have used it as a makeup primer. It uh, can layer under makeup for a lot of people. It doesn't feel greasy. It's very lightweight because it has no mineral component to it. And so a lot of people in the beauty industry favor this type of sunscreen. It does have four of the chemicals in there: avobenzone, homosalate, octosalate, and octocrylene in various percentages. And then the other one is Dr. Idris Disco Block. I don't know where they come up with these marketing names. And this is both this one is a combo mineral plus avobenzone, homosalate, octocrylene, and octosalate. It also contains some hexyl resorcinol, so supposedly it might help with melasma and hyperpigmentation. It's a whipped formulation, so it's very light. I haven't tried these two.
Me neither.
Okay. So, I mean, people love the Supergoop. I'm not a makeup person, so I know I don't put makeup on my face. But like I said, if you feel like that one is the best in terms of application, in terms of using every day, then you should use it. Now, uh, some application very quickly. Let's talk a little bit about application, because I am one of those people that will do it once during the day and then forget to put it on later, and I probably shortchange myself when I do that. So, what are the general rules in terms of how we should be using sunscreen on a daily basis?
So number one is you have to put enough on your face or on your neck, because even if you have the best sunscreen and it's a high SPF, if you don't put enough, it's not going to give you the amount of protection that you wanna use. So about a quarter of a teaspoon is what you're going to use for the face and neck. And if it's a chemical sunscreen, you want to use it about 15 minutes before you go into the sun. So number one, put the proper amount. Putting more is better than putting an insufficient amount. Number two, reapplication. So to be safe, you should be applying every 2 hours when you're outdoors. And also, if you get wet due to swimming or sweating or wiping your face after you eat, with a napkin, you should reapply. And then, you should use something every day. Like I said before, UVA penetrates clouds and glass, so when you're driving, you're going to have the effects of UV radiation if your face is not protected. So sunscreen should be thought of as something you're using every day, not just when it's sunny, not just when you're, going outside. So
I agree.
that's how I would recommend using.
Even on cold days, snowy days, just make it part of your daily regimen, and then you don't even have to think about it. It's just like brushing your teeth or something like that. Way it's not a thing where you're like, oh, it's sunny, I'm going to put it on today. Just put it on every day. It just makes it so much easier. And if you're worried about vitamin D deficiency, normal, studies have shown that people who use sunscreen have normal vitamin D levels. But if you are freaked out, just take supplements like 99% of the world does right now anyway for vitamin D, and you'll be fine. So let's suppose you don't like the mineral sunscreens and you're freaked out about the chemical concerns. Well, what can you do? And fortunately, there are now newer sunscreens available that have not been fully approved in the United States yet, but are used throughout Asia as well as in Europe. And these are newer UV filters chemicals, which do not have the endocrine disrupting effects, as far as we know, in terms of the studies that have been completed, and they are not reef toxic or damage marine ecosystems as our current U.S. Approved sunscreens are, and a lot of these are formulated to be very kind and sort of glowy. If you've ever seen some of these commercials for these sunscreens, it's amazing. It's almost like the skin looks like it's popping off of the screen because of the texture. So I will mention two which I just ordered and I'm going to try, and hopefully they will be awesome for me. The first one is Beauty of Joseon Relief Sun, which is a rice and probiotics formula. This is available. I did order it on Amazon. It's a creamy lotion enriched with 30% rice extract and fermented probiotics. It's supposed to leave a satin glow with no white cast. And the chemicals involved are Uvinol A+, Uvinol T150, and Tinazorb M. And these are photostable, low absorption UV filters that have been approved both in Asia and in the European Union. The other one, I'll mention three really quickly. The other two, which I haven't tried either, Round Lab Birch Juice Moisturizing Sunscreen, has birch sap, which I have no idea why it would include birch sap, but it has that. And then Skin 1004 Centella Air Fit Sunscreen Plus, which actually this one has a mineral formula in it as well. So it probably might have a little bit of a white cast. You're gonna have to try it out and see what you think.
Well, the names of these just roll right off the tongue. But if you ask me, anything that's sun protectant, makes my skin look better, and has rice, I'm all for it.
I eat rice almost every day. I have no problems putting a rice product on my face. So in closing, Larry, well, let me ask you this: what do you use right now for your sunscreen?
Right now, I use a Skin Medica product that we sell it in our office. It's an SPF 50. I don't recall exactly what the ingredients are, but I believe it is a chemical sunscreen, and
Yeah.
that's what I use every day. And I carry it around with me if I'm going out biking or doing some sort of outdoor activity, so I can reapply as needed.
Yeah, you have some of the best skin for a plastic surgeon I've ever seen. I will say that. Like my skin ages terribly, and I'm going to be much better now in the future about wearing sunscreen. But you've always had, you know, that Asian glow to you that
You're making me
that
feel
that
uncomfortable.
that has never
Thank you. No,
faded.
no, I'm just kidding. Thank you very much.
So,
It is, it is
yeah,
something that I try to really not go in the sun as much as possible, and a lot of it's just genetics as well.
true. But we can always do our best in terms of doing better. So, first thing, wear sunscreen. Wear it every day. Doesn't matter what type it is, as long as you're actually liking it and using it. There are chemical sunscreens, mineral sunscreens, combos. There are some new ones out there available from Asia and Europe that might be more to your liking or to your preference. And as Larry said, you can do a lot by helping yourself out and minimizing sun damage, skin cancers, so you don't have to see us in the office so often.
That's right. And
Any other thought?
do it early. Don't wait until it's too
Yes,
late. Once it's too late, it's too late.
that's exactly so profound, Larry. I love that.
Yes.
All right, thank you so much, and until next time, we'll see you then.